Spread over 31 square kilometers, Dhenkanal city of Odisha has a population of about 75,000, residing in 15,000 households. This figure has registered nearly 16% growth over the past decade. There are 23 wards and 17 notified slums within the administrative boundary of Dhenkanal municipality. About 60% of the households have toilet containment units, such as septic tanks or pits. However, fecal sludge management had not received any attention in the city over the years. In the absence of sewerage networks or a FSTP, fecal sludge was collected either manually or mechanically and disposed of in open fields, drains, water bodies, individual land, or solid waste dumping yard. The disposal was left untreated, resulting in serious health hazards to city dwellers. To deal with this challenge, Project Nirmal is being implemented in the municipality in collaboration with the Housing and Urban Development Department, Government of Odisha, to demonstrate a city-wide fecal sludge management in Dhenkanal municipality. The fecal sludge treatment plant of a capacity of 27 cubic meter per day is designed to treat the sludge generated from pits, septic tanks, public toilet or community toilet containment units. These initiatives also help to institutionalize a sustainable sanitation service delivery system for the city and a model for other cities. Fecal sludge disposal will no more be a concern for Dhenkanal municipality now.
Hello, I am Anju Dwivedi, working as a senior researcher in Center for Policy Research in the team of Sci-Fi. Today I am going to present a case of two small cities in Odisha which worked on fecal sludge management with the support from Center for Policy Research, Practical Action, Bill and Melinda Gates Foundation and Aragyam. This film that you just saw is one of the cases that I am going to talk about when we are mentioning about two small cities. The project name is the Project Nirmal, which started in 2015 January in Odisha. So when we started working on this project in 2015, an analysis of sanitation situation in the state of Odisha was undertaken a year before in 2014, and we saw that Odisha is one of the least urbanized state as per 2011 census, and there is high dependence on on-site sanitation facilities in the state. If you look at India average and Odisha average, you would find that there is very poor network of sewer in the whole state, and in the smaller cities it is even very less as compared to the larger cities, and the dependence on the on-site sanitation systems is also huge as compared to all India average. So it is more than 45% if you calculate that way, and high rates of open defecation are seen in the state as per 2011 census. So we also found that in the state, though there were activities undertaken around developing city sanitation plans as per the NUSP mandate, as well as there was an Odisha sanitation strategy which was made in 2011, but we found that the focus on FSM was not there. So we found it was an opportune time to do some work in the state of Odisha, and we started working with the government. And while we were working with the government, there was also a need by the government to show some models on FSM in the state of Odisha. So it was just not the research, but a component of implementation that was strongly stressed upon. So that led to the birth of this project Nirmal, which is an implementation project in the state of Odisha in two cities, Angul Dhenkanal. It aims to demonstrate sustained sanitation service delivery in these two small towns, enabling institutional arrangement and increasing public and private participation. So we started intervening since January 2015. Both these cities are very small cities, less than 1 lakh population. Very few households, not more than 15,000 households as per 2011 census, and the coverage of septic tank is over 60% in these two cities. So these cities were given to us by the state government to work on and to demonstrate a pilot showing appropriate FSM technologies in a decentralized manner. So the project was implemented with the support of Practical Action, which is one of an NGO working in Odisha on small solutions for the poor, and with the support of Aragyam and BMGF. And the project looked at various components. It was just not an implementation project on construction of infrastructure, but we in the project designed enabling policy frameworks to get through by the state government, capacity building, participatory planning, behavior change, and pilot, of course, which was a key component in the whole project design. And to achieve this vision and to have this multi-pronged strategy working in the state, it was very important to work with multiple stakeholders. So we worked with the communities, we worked at the district, we worked with the city ULBs, we worked with the state government, we worked with NGOs, and we worked, of course, with the funding organizations. And we also engaged private sector in delivering the services when the construction and the commissioning of FSTP happened. First thing we felt in 2015 was that there was a lack of understanding completely at the city as well as the state level on what is fecal sludge management and why should we address this problem, what is it causing. Even in the cities, when we talked with the city governments, there was completely lack of information and knowledge on how to deal with such a gigantic problem like managing sanitation. Swachh Bharat mission had actually at that time had come, and there was a huge focus on toilet construction. But when we were discussing on FSM, it was not only the toilet construction, but actually it emphasized on complete value chain of FSM, which involved containment, proper containment of fecal sludge, then collection, then safe transportation, safe disposal, and of course the last leg of the value chain is recycle and reuse. So this was a concept which was totally new to the cities as well as the state government. People did not know how it has to be done in India. There were no experiments at that time, neither any FSTP was constructed that time. So there was of course lack of even demonstration in the country. So it was very difficult in the beginning to start with that, and we also felt that the communities have also to be engaged because it is a behavior change, definitely, as Swachh Bharat also emphasized upon. But when we talk about FSM in the whole value chain, we just did not look at them as people who have to build the toilet, but also look at how their fecal sludge, if it is not managed properly, is harming the environment and their own health. So we started the campaigns around that by engaging communities. So we established the slum sanitation committee in the project, representing the poor and marginalized. Then at the ward level, we built the ward sanitation committees. At the city level, there is a city sanitation task force, which also has the voices of these poor and marginalized represented at the city level. And then there is a district coordination committee, which is headed by the district collector. And of course, at the state level, there is secretary, there is a HUDD department, which is headed and chaired by the secretary, who was the nodal for this project. And this institutional structure helped us to get the problems addressed on time, and also to pass on the decisions to the communities which were taken at the state level. So it worked both ways. So it is a bottom up as well as a approach which we followed in our strategy, as well as sometimes a top down, which was like what state is thinking about fecal sludge management and how communities have to be addressed. So this is how we started implementing our project, by building these structures and strengthening them in the course of action. Yeah, Amit, I think in between May and June, we also tried to understand what was the sanitation situation in these two cities of Angul, Dhenkanal, and we found that a lot of people did not know, and there were toilets, but most of the toilets were confined to certain pockets, and not all slum dwellers were getting the toilets. Then there were issues of open discharge. The waste was taken and disposed in open drains. There was no proper collection mechanism of waste. There was rampant manual scavenging in these two cities. To address this, we felt it was necessary to evolve a policy at the government level, at the state level, to look at all these components. So we helped the state government to frame a policy on Odisha urban sanitation, which was called Odisha Urban Sanitation Policy, as well as a strategy. This helped us to first have an enabling framework developed at the state, and as well as a direction for the cities to how to address this whole issue of fecal sludge management in their cities. And we found it very potential tool, in the sense that in fact Odisha is one of the states which had this policy just before the national policy came. So it was one of the pioneering state that way to have evolved a strategy and a policy on fecal sludge management before even the national government could notify it. So this was one of the key achievements. Then as the communities were developed and strengthened, community started demanding more accountability from the governance structures. There were issues related to safe disposal of waste and cleanliness of their drains, and all those issues got a lot of traction at the city level, and the governments became accountable to the poor, and we saw the changes in the communities in the whole project cycle. Another thing that we addressed was the capacity building. Actually, we believe that if you don't have capacities at the state or at the city level to deal with this issue, you cannot, despite your well intentions, you cannot deliver. So we strengthened capacities of the cities. We, with the state government, developed a training manual on non-sewage sanitation, which was also the first time initiative in the state, it is now adopted by the state for their training programs in their own state for the new ULBs who are coming to address this issue of fecal sludge management in their respective areas. So it is not the capacity building through only structured training programs. We oriented the state government, took them to various exposure trips to Malaysia to understand how Malaysia dealt with this problem many years ago. And of course, India and Malaysia were at very different stage at that time. But learning from Malaysia helped the state government to strengthen this program in their state. After all these interventions which were going at the ground, which was also done with the district, with the cities, with the state government, with their support, we could come up with a fecal sludge treatment plant in Dhenkanal, which is of 27 KLD. This is first plant in the state which is for the smaller cities, because by this time Amrut also came and took 9 cities in Odisha to develop the FSTP. But Dhenkanal FSTP is first plant in the state for a smaller city which is less than 1 lakh population. So it is just not FSTP, but the complete fecal sludge management was brought in. With the cities, we worked on how this will be operated. So we brought the private operator and who is running this plant with us for a year, and then we are going to hand it over to the state government to run, which the state government can work with ULBs to continue working on this. But so far the results have been very good. Not only that, we could actually address all those and could comply with all the environmental standards that are required for any FSTP to function. There has been a lot of effort and motivation by the private sector to engage themselves in this service, and as you saw in the film also, that how the cesspool operators are servicing and addressing the larger environmental issue of pollution and unsafe disposal of fecal sludge. So today, when we are standing in 2019, we see a lot of change in these two cities. And if we compare not only in these two cities but at the state level, Odisha is one of the states which has come up with not only with the policy but also how to address this problem in another 114 cities, which are of course small, not all are large. Looking at Dhenkanal as a model, and there was a rampant open defecation, manual emptying, there were manual scavengers involved, there was no policy, there were no FSM regulations at that time, there was no septic treatment plants built in the state, and there was hardly any community engagement for this kind of work, and there was no experience at all on engaging private sector. No capacity building has ever taken on FSM in the state, and there was no operational and maintenance by any private sector. So this was the situation before 2015, or when we started working 2015. But now when we see the state not only has built another 9 FSTPs, it has tendered out 26 more FSTPs in the state, and there is a FSM regulation policy, there is a mechanical emptying process which has been initiated in these 2 towns as well as in other towns in state of Odisha. There is a large focus on engaging communities in FSM, and there are lots of processes which have been streamlined in this state. So these are some of the impacts that we could feel that has come in the state, and Odisha is considered as one of the states in India to have pioneered this and are considered as the champions in fecal sludge management. This work of FSM in Odisha has been recognized nationally, and it has received awards also. So Dhenkanal has recently been awarded at the national event by the national government to have evolved a plant and have evolved a strategy around FSM in the country as a small town. So it is one of the examples not only in Odisha but I think also nationally. Many cities can learn from the experience of Odisha. So this was a case study of 2 cities of Odisha, and I somehow feel that I've seen the changes of being evolved, or the changes that have happened over a period of 5 years. It gives me a lot of satisfaction and motivation. So as a sci-fi representative and also a person who have worked with the other partners in the state, I feel very proud to be associated with this project. A lot of information is available already on our website, what the kind of researches that we have done. And also there is a Facebook page of Project Nirmal where you can actually get the updates of what is happening and what has happened in the past on Project Nirmal. Thank you very much.